Dr. Ghali, good morning. And obviously, you know that Robert is at home, tested positive for COVID on Monday. I'm in quarantine because we were together in a room Monday for 3+ hours. What should Robert watch for? What is the first thing he should look out for here in the next few days? I mean, he says he's feeling fine.
Yeah, how are you?
Good.
Well, I mean, certainly the most critical aspect of this coronavirus and what folks need to look for are particularly difficulties with breathing. I mean, most of this other stuff, the fever, the cough, changes in your sensibility to smell and taste, those are fairly minor compared to the issue with breathing. Are you getting enough oxygen? If you have one of those little finger pulse oximeters at home and it has any indication that your oxygen level is dropping, below 95 or 94%, then these are indicators that really something's going on with your lungs and you need to come in.
What about meds that he can take? I mean, he's talked about hydroxychloroquine, remdesivir. Are there some routine meds, other things he should be on right now from home?
Not really. As far as remdesivir and hydroxychloroquine really hasn't been shown in studies to really be beneficial in the majority of the studies that the folks have looked at. Remdesivir is still, I think it works well. I got it myself when I was in the hospital, but again, it's restricted to in hospital use. So someone would have to be sick enough to be in the hospital to get the antiviral remdesivir. Yeah, there's some prophylactic things that folks have talked about, like vitamin D and things like that. But certainly once you have the virus, it's too late to take the prophylactic medications. As far as other things that some people have been prescribed, it sort of depends on your own practitioner, what he wants to give. Some folks will give a Z-Pack, a Zithromax or something like that. But again, mainly staying well hydrated, taking Tylenol for your fever, taking good over-the-counter cough medicine, and just watching to see if there's any deliberate breathing issues that would warrant you coming into the emergency room or to your doctor, who can then put you in the hospital if it's necessary.
Okay, when is someone like Robert, who tested positive Monday, when is he clear to go back out among us, and how does he go about doing that?
Right. Well, two things if I can just touch on. One is from the time that he first became symptomatic, the peak of potential issues with COVID is around 5 to 7 days, which means that's when if the disease process is going to progress, and remember, Aaron, it affects people differently, the peak is around 5 to 7 days of when there could be a potential cytokine storm, where you begin having significant inflammatory reaction within the lungs, which can be a quick downward spiral. So you have to make sure that 5 to 7 day period, you're really very vigilant about breathing issues. As far as when he can go back, if you've tested positive, a 10-day confinement from when you tested positive is the way to go per CDC guidelines. For those individuals that are considered close contacts but have not necessarily been tested positive, they were just a close contact, a verified close contact, then they would require a 14-day isolation period. So
why the difference between somebody like me, who was in contact with him, I'm 14 days, and he who has it is 10?
Yeah, and again, there is variability with that, but that's the general guide.
Should he be retested before he comes back into the office setting?
No, not necessarily. Not unless he becomes resymptomatic. Most folks that have the COVID, the first 2 or 3 days is when they have their fever, and then they become fairly asymptomatic, and some folks aren't even symptomatic. Did you say he was symptomatic?
He was symptomatic on Sunday night, but it was sinus to him, really.
Right, correct. Yeah, that still counts as a symptom, though. and that period of confinement is 10 days. If you're asymptomatic, the reason they extended out to 14 days is most people didn't get tested positive. They just assume it's a close contact. So we're trying to use the longer period of potential incubation of the virus versus the shorter period of 10 days, just to be safe.
Okay, help me out. This is completely personal. Me, Ruben, anybody that worked with Robert, what should we watch for? I guess those that were in close contact, what should I look out for? I've got a sore throat right now, no fever, but just a scratchy throat. Is it a concern for you?
It's not a concern, but I mean that would fall into that constellation of it being symptomatic. And did you get tested? Remind me.
I got tested on Monday, and it was negative, but I was told by a lot of folks that was too early.
And the folks that are telling you that are correct. That's in the very early range of when it could be positive. But again, more than likely, if you were a true close contact and you have a symptom, and you were to get retested around 3 to 4 days from your exposure point, because it sounds like you got tested the next day after potential exposure. If you waited 3 or 4 days, you may find if you get retested now that you're going to be positive. Not that it would really make a difference in your confinement period at this point.
Gotcha. This is just what happens in my life with Robert. Robert brings me coffee. You've been in the studio with us probably. He goes and gets me coffee. He puts it right beside me. He's touching the styrofoam cup. I then touch the styrofoam cup. Can COVID live on something like that?
Well, yes, it can in theory. But again, the droplets, the aerosols, that's the way that it's mostly transmitted. Aerosol droplet in being inhaled either through your mouth or through your nose. It is less likely to be transmitted on inanimate surfaces. And the more porous the inanimate surface, like, for example, blue jeans or a piece of paper or styrofoam, the more porous it is, the less likely it is to be transmitted over time. Now, certainly, if he sneezed in your coffee cup, and then you say, "Oh, can you sneeze again on there?" And he sneezes again on there, and you take your tongue and lick the edge of the coffee cup, then that would be a different story. But the likelihood of it just being transferred by his hand to your hands or to your lips from the coffee cup is pretty darn remote. And again, if things are more porous, like if you're talking about a marble top, and then somebody sneezes on a marble top, and then you take your hand and wipe that marble top very soon afterwards, and then stick your hands in your nose or mouth, that is a much higher likelihood than a styrofoam cup or something like that.
Dr. G.E. Ghali, I can't thank you enough for the time. I know I've got you on speed dial. If something happens, we'll be in touch.
Hey, God bless, and thank you.